Let's discuss about the gastroenterology disorders of pregnancy. And in this gastroenterology disorders, we will discuss mainly about the peptic ulcer disease, which is very common, gastroenterology disorders of pregnancy. And also we will talk about celiac disease and inflammatory bowel disease and pancreatitis. So first, peptic ulcer disease. This is the esophagus, stomach, and then this is the ulcer present in the stomach. So ulcer is any erosion of the lining of the stomach, and it's in the that can make it more vulnerable to different medicines, foods, and secretions. All these ulcer makes the patient more vulnerable, so they have pain in the epigastric region is present with the peptic ulcer disease. So less common in pregnancy, peptic ulcer disease. Pre-existing ulceration usually improves with pregnancy. Complications are rare during pregnancy. Next is celiac disease. This is the diagram of the celiac disease. It's a gluten-sensitive enteropathy. Prevalence is 1 in 70 pregnant women. Usually they can have celiac disease. High rate of spontaneous miscarriage if untreated. So spontaneous miscarriage occur if the celiac disease is not treated during pregnancy. These are if you see, these are the crypts of Langerhans. Then the epithelial cells are present, and then there are lymphocytes. So all these are this is the picture of the patient with the celiac disease. Fetal growth restriction is common. Then inflammatory bowel disease is another condition in which in mild or quiescent disease, fetal outcome is nearly normal. So it's not affect the outcome of the pregnancy. If the condition is mild, the outcome is nearly normal. This is the diagram. That's the colon. We have ascending colon, transfer, descending colon. Then we have inside the small intestine. And if you see, this is the inflammatory bowel disease. The bowel is all inflamed, red, and swollen. Spontaneous abortion, stillbirth, and developmental defects increased with increased disease activity. So all these complications can occur if the disease progresses or if the disease is severe during pregnancy. Patient should be in remission for 6 months before conceiving. So it's very important that proper counseling of the patient should be done, and the pregnancy of patients who have inflammatory bowel disease should be a planned pregnancy, and they should have a 6-month period or 6-month disease-free interval before they conceive. So it should be properly planned and managed pregnancy. C-section is preferred in case of anorectal and perirectal abscess or fistula. If the inflammatory disease lead to the formation of abscess or fistulas, fistulas are the connection between two structures. If these fistulas are formed or if there is abscess, it's preferred that C-section should be performed for delivery, not the normal vaginal delivery. Next condition I want to talk about is pancreatitis, which is the inflammation of the pancreas. Pancreas is the gland present, secretes different hormones and enzymes. Very important enzymes are produced by the pancreas that help in the digestion of the food, and then insulin is produced by the pancreas, which is responsible for metabolism of the glucose. So here this is the pancreas. This C-shaped structure is the duodenum, and it is present. Pancreas lies in this C of the duodenum. So inflamed pancreas, this diagram you see, there is redness and inflammation of the pancreas. Pancreatitis is not very common in pregnancy. It's uncommon in pregnancy. Usually, if it is present, usually it occurs in the third trimester of the pregnancy. The causes of pancreatitis can be gallstones or the stones present in the gallbladder. This is the gallbladder. Stones are common in gallbladder, and if those stones are present, sometimes they can cause pancreatitis. Ingestion of alcohol can cause pancreatitis. Then we have hypertriglyceridemia and hyperparathyroidism. All these are the condition if there is increased triglycerides in the blood, and if there is increased secretion of hormone from the parathyroid gland. All these can cause pancreatitis, but the good thing is pancreatitis is not very common during pregnancy, and if it do occur, it is more common towards the end of the pregnancy in the third trimester of pregnancy. So that was all about the gastrointestinal disorders which are common in pregnancy or which can occur during pregnancy even if they are not very common. Thank you for watching sqadia.com.